I chose to become a pharmacist for the sense of community. Growing up, I had asthma as a kid, and so we were constantly seeing our own pharmacist month in, month out for prescriptions for me to stay healthy. And he knew everything about me as a kid just by talking to my mom and my dad when they would pick up prescriptions. And as I was growing up and going through high school and deciding what I wanted to do with my life, I kind of came to the realization that that's what I want to do. I want to be able to improve people's health, but know things about their family too. I want to be able to essentially help my friends and family as a part of my community get to the best health they can be. I had an older, about middle-aged gentleman come in. He had a long history of diabetes for a comprehensive medication review, and I was going through his laundry list of medications for diabetes, hypertension. He had reflux, insomnia. It was a total train wreck, as he described it. And he said at the end of the review, after I had said, like, these are the things that we can do for you to get to the peak of your health, he mentioned he was getting nervous about a procedure at the end of the summer. And I asked him, like, what do you mean, what procedure? And he mentioned he was having a gastric bypass. I'm looking at his med list again, and I'm like, have you talked to your doctor about making changes? Because half these aren't going to work after your stomach's changed. He was like, well, no, my doctor didn't say anything. And I'm like, of course. So I called over there, faxed him a recommendation list, and within a day I got a response back from the doctor saying, like, he had no idea, that slipped his mind. He didn't know that medications would have to be changed after you have a surgery like that. So he was very grateful for the information, and now we're just waiting for the procedure for that patient. Pharmacists deserve provider status because we are just ready and willing to provide our expertise to the healthcare field. When you really step back and look at the increasingly older population of the United States and how increasingly complex a lot of these medication regimens are getting, it's high time that we just let the medication specialists step into the forefield and start giving basically our 2 cents onto the whole individual thing. I mean, we are the perfect position. We already have the training. We already have the expertise. There's really no reason why we shouldn't be stepping in and saying, like, this is the best thing that we can do for this patient.